Okay, so before I start, I think it's an honor to be sharing the podium with Dr. Reddy, and I have
Thank you, Kamal.
huge respect for him, and Dr. Maipal, of course, a dear friend, Rishi, and I think I must thank Boston Law and AIOC for creating this platform for sharing information, knowledge, and the best part is, in spite of bad COVID times, the spirit of academics and sharing is still going on, and that's so encouraging. So I'll be sharing this presentation on Stellaris Elite Vision Enhancement System. As most of people know, I'm a big, huge Venturi fan, and I'm a diehard Venturi fan, and I just love the fluidics of the machine. So I'll be speaking from my personal experience, and I will also be touching some very basic points of an enhancing understanding of why a Venturi system would probably outdo a peristaltic system, even a very high-end peristaltic system. But here we are talking about Stellaris Elite, and I am a technical guy with my hands-on physics, so I will try and explain with physics examples. I have no financial interest in any of the machines I'll be talking about. There are three models available: the Stellaris Elite Anterior, the Stellaris Elite PC, and the Stellaris Elite PC with a laser machine. Now, what is new in this machine? I actually feel, Stellaris actually, in my mind, personal, was a gold standard when it came to fluidics. Most of the other machines in the market were, having all the bells and whistles of, the fluidics, the, surge controls and new pumps coming in and new softwares. But the basic of understanding a Venturi system, how it behaves, Venturi is always a real-time vacuum on your tip. Let's understand, when we use a peristaltic machine, there are rollers which are moving, and the vacuum is transmitted across the tubing, and then the tip has to be occluded. And the amount of occlusion of the tip decides what is the vacuum you get on the tip. So you could have a 300 vacuum in the machine, but if your tip is 50% occluded, you would have 50% of 300, but not the same with Venturi. If your foot is at 50% of 300, you get 150. If your foot is full at 300, at the tip, you get 300. So that makes it very predictable. Now, add on to that the adaptive fluidics, this new dynamic fluid compensation system, which has got a controlled pressure, maintaining an infusion and outflow mechanism, which is being monitored. Now, what it does is, we will see as we move on, this is called adaptive fluidics. So coupled with a beautiful pump system of a Venturi machine, we have a system which is now linearly controlling your infusion pressure in the eye, which means most of the machines where they are gravity fed or pressure fed, if you stop the fluid, let's say a surgeon is operating under a continuous flow, what happens? There's no outflow. And if you have a tight wound, and even if you have a leaky wound, the pressure goes up. And the moment you go on to vacuum, the fluid flow rate starts. Let's talk about a flow-based system or a peristaltic system. The fluid starts coming out, and that's when the pressure starts coming down. Now, what happens is, in pressure-based systems, in the other peristaltic machines, the response time is based on how the pump starts and how the compression of the fluid bag happens. Unlike this, in a Venturi machine, you have, the moment your vacuum keeps going up, linearly, the pressure in the bottle keeps going up. So it maintains a constant infusion pressure in the machine, which is real time. And coupled with the aspiration of a Venturi machine, the vacuum at the tip is vacuum in the machine. So you can actually tailor make the fluidics and the balancing of the infusion pressure very accurately. So it's a real time actual monitoring of the fluids. What else does this new machine have? In the interior segment, you can have a cut rate of 5,000 to 7,500, and especially the basic machine, the cut rate has gone down to 2,500. You have an active reflux, and I said I will be talking about adaptive fluidics if my time permits. You have a dual cutter for the other my colleagues in vitreoretina. Now, how does this do that? It monitors your flow rate, vacuum flow rate in the machine. There are sensors, and the moment the vacuum flow rate increases, the vacuum increases, the machine automatically pumps more air into the bottle and compensates for the increase in vacuum. Now, let us understand the very basic fluidics, and then I'll build on it. The flow is how fast a cataract piece is sucked towards the phaco tip. A vacuum is how hard it is held once it is coming there. And of course, the phaco power is how much of cutting force the thing has, or the phaco tip has. I'll be discussing all these threadbare. Now, this is what an aspiration flow rate does. A peristaltic machine, when it tries to behave like a Venturi machine, has to go on a very high flow rate. But what happens? The moment you go near a piece, it's sucked in, and then the occlusion goes, and you lose the occlusion. And when you lose the occlusion, the vacuum drops again. And then again, you need to look for an occlusion to build the vacuum again. So if a surgeon really wants to operate hard, he needs to increase the flow rate, but then there are the other collateral issues which go with the increased flow rate. Now, what happens? What does a vacuum do? Now, in case you have a Venturi system, the vacuum is always there at the tip. So if your foot is in phase 2, the vacuum is already there, whether it's occluded with a phaco fragment or not. Unlike a peristaltic system, if you lose the fragment, the vacuum is lost. Then you again need to go and occlude your phaco tip. Now, the basic difference is,
Dr. Kamal, are you there? Okay, while we wait for him, are there any discussions we'd like to do from the previous talk? Okay, are you back, Dr. Kamal? All okay?
A gentle reminder, sir, there is a 12 minutes to conclude the session.
I thought we have time until 12:55.
Yes, sir, that is 12 minutes from now.
Yeah, 12 minutes. That's fine.
Yeah.
Dr. KP Reddy, any comments so far? While we wait for Dr. Kamal.
You have to unmute yourself.
We can't hear you.
Dr. Reddy has to unmute himself.
Yeah.
Yes.
I think
Can you
I
hear
lost
me
the
now?
internet. Can you hear me now, sir?
Dr. Kamal, are you okay now?
Yeah, I lost my internet.
Okay, Kamal.
Okay. Please continue.
Yeah, this is the basic difference. I'm sure all surgeons know that, but I just want to highlight a few points. In peristaltic, the vacuum only will be created when the phaco tip is occluded. So what does that do for the surgeon? You need to hunt for a phaco tip to come towards you. But in case you don't want to hunt for the piece, you need to increase the flow rate. When you increase the flow rate, the piece is sucked in faster, or the flow rate probably starts pulling things faster towards your phaco tip. Whereas this is not required in a Venturi system. We will extrapolate this in an elite system. Now, this vacuum is always dependent on how much amount of percentage the phaco tip is occluded in a peristaltic system. Whereas in a Venturi system, it is totally independent of how much of tip is occluded. Now, what does this do on the real world? In case you lost your vacuum for a fraction of a second, you need to take your foot off. So during that time, you have lost some energy. So there is again a lost escaped energy. Whereas in a Venturi system with a good flow, there is energy is always absorbed and the piece is always there at the tip. Now in adaptive fluidics, what happens is the moment we will see this graph, the moment you go on to vacuum, the pressure in the bottle goes up like here and increases the pressure inside the eye. Now, unlike a normal situation, which is probably with the earlier Stellaris machine, what we were doing was if the pressure was actually going, if the vacuum was going up, the pressure would go down drastically. But in adaptive fluidics, it maintains the constant pressure. So the surgeon can actually decide what is the infusion pressure in the bottle he wants, and he can have a constant pressure irrespective of the bottle height and the vacuum setting he's at. So this would give a predictive advantage in glaucoma patients. Now let us understand about the marriage of a good tip with a 28.5 kilohertz handpiece. This is how a cataract would be cut, and you see that it is the flat edges of the phaco tip which actually cause cavitation bubbles and cause the breaking of cataract. Now what does a Venturi machine which is working at 28.5 hertz help us? Now let us see all the phaco tips we have. There is a comparative study. The actual cutting is done by the mass face of the edge of the phaco tip. And what we have in Stellaris is we have the famous Dr. Barrett's microflow needle. Now this has got a very thick flat face. So the raw energy which is being delivered for cavitronics is very high. And there are side grooves which work here which help to cool the wound and cool the tip. So this comes to advantage because you're working at a 28.5 kilohertz tip, which actually has a very strong, a very long stroke length. Most of the machines we work are working at 85 mils to 100 mils. This is the only machine in the market which is going up to 140 mils. Now, what it means is longer the stroke length, better the cutting. But yes, it generates more heat and cause wound burn. This is where the microflow tip comes to our advantage. In microflow tip, there is more mass at the edge. There is a diaphragmatic cut section and there are cooling areas in the side. So you can marry this needle to a 28.5 needle and get the best possible thing. I will jump this, sir. I think this is a bit, yeah, this is interesting. Now, when you do a comparative of adaptive fluidics, it has been proven that it is far more faster response time in maintaining the intraocular pressure, infusion pressure, better than Infinity and better than Centurion. It's 3 times faster for the simple reason the response time of a vacuum in a Venturi machine is better. Now, as sir, Dr. Reddy, with your permission, I just take 2 minutes extra to explain how the cavitronics works.
Yeah,
Now,
go ahead.
In a Venturi machine, as I said, or in any phaco machine, the main cutting is caused by the cavitronics and the mechanical impact. Now, all machines will have the same mechanical impact, but a machine with a longer stroke length will have a better mechanical impact. So here again, a Stellaris wins because it is working at a 28.5 kilohertz frequency. Second, the cavitration. This is the mechanical impact. Now, this would be fixed for different machines. Stellaris is 72 kilometers speed. Acoustical wave, we will not talk. This is interesting. So when a cavitation, what happens in cavitation is when the phaco tip goes and hits the cataract and comes back, if it has a longer time to come back, the bubble size caused by the cavitronic is larger. And when this bubble implodes, it releases higher energy. So all machines which have a higher frequency will create smaller bubbles, but a machine which is got a lower frequency will create a larger bubble, hence a larger, more frequency and more energy released. Now, this is a frequency of most of the machines used in the market. As we say, Stellaris is a very low frequency machine. Now, to make us understand how the cavitronic works, sir, I will explain. This is a video of an AK-47 gun fired underwater. See what happens. The bullet has been fired. This is the first explosion and now the implosion. See the bulb. This is the implosion. Now, this implosion releases 2.8 times higher energy than the explosion itself. Now, we will again see this. The gun is firing. This is in very slow motion. Implosion. And there you see release of energy. The similar thing is seen in a phaco tip. And we will see one more video. This is an interesting video. You will see that the gun is fired underwater. And now you notice there is far more energy released with the implosion of the cavitronics. So much so that the water even on the surface comes out. This is what causes the most cutting in a cataract machine more than a mechanical impact. An average surgeon understands maybe the phaco tip is cutting into the cataract, but that is only 25% of the cutting. 70% of the cutting is coming from the cavitronics. So which gives us to the very fact that the machine like Millennium working at 28 kilohertz has got far larger cavitronic bubbles, releases more energy, and is coupled with the microflow tip, gives you a very, very good cutting energy. Now, this is again, I will jump. Yeah. Now, again, this is again coming to the attune. This is how the attune mechanism works in this new machine. So you have adaptive fluidics, which are maintaining an inflow, constant infusion pressure, attune, which is collaborating your phaco energy delivery, using it to its maximum efficiency, maximum cutting, least heat generation with using in combination with the microflow, and a dual linear Bluetooth foot pedal, which actually enhances the experience of the surgery. Now, this is again not my part, but the retina part is that, the new Vitti's cutting system, which is there, which is giving you 1.7 million cuts per second. This is even, it beats imagination that you could have a vitrectomy machine, which is working on an ultrasonic platform, and it cuts the vitreous at the edge of the cutting tip at 1.7 million cuts a second. I think that is going to take the vitrectomy and for posterior segment surgeons to the next generation. So no wonder they call the Stellaris Elite the machine for the next generation. So you have a cutting option, which is increased to 15,000. As I was talking about, this is the most intriguing thing. We are looking forward to having this in our systems now. And I'm told by Bausch & Lomb that probably they'll be coming in very soon. Now, this is going to transform the way vitreous surgery is done. Thank you. Thanks a lot.